Hi, my name is Dr. Andrea Furlan. I am a pain physician and specialist in Toronto, Canada. And today I'm going to answer your questions that you posted on my YouTube channel the first week of December 2020. And please remember, this video is more for education. It's because I found many questions were very good for clarification, for more explanations, so I decided to make this Q&A video. But I will not be able to answer questions if you have a particular problem. In fact, if you have pain and you are suffering or you have any health problem, I advise you to talk to your doctor to seek medical care because I cannot provide this for you via this YouTube channel. But what I can do here is answer some questions that are very relevant and excellent for educational purposes. So let's start. The first questions are all related to the video of hip and knee osteoarthritis. I have a lot of questions about that one, and then at the end we have some questions about the other videos as well. So the first question on this video is, can the person do these exercises if the knee is swollen? So actually, swollen knee, we call this effusion. A knee has water in the knees. That's what we mean by swollen knee. First of all, we need to find what's causing the swelling. Is it because of an acute inflammatory arthritis? Is it because of some trauma? Did the person traumatize and injured some structures inside of the knee? Is it because of a ligament or meniscus problem? Is it sports related? So we need to find out what's the cause. If this is more acute. Acute means this swelling, this effusion is happening for the past days or a couple of weeks. Then if the person is not having an acute problem, it's more like a chronic problem, osteoarthritis can cause knee swelling, which is more like months and years. The knee is always swollen and big. In this case, if the swelling is being caused by osteoarthritis, yes, and then the person can do these exercises, and actually doing this exercise can even help to reduce the swelling of the knee. So thank you for the question. The next question is still about this video, is what is a good exercise for knee without cartilage to improve it in order to avoid suffering from pain? Well, if the knee doesn't have any cartilage anymore, and not only the knee but the hip, this means that this is an advanced type of osteoarthritis. We know that osteoarthritis can have 4 stages. Stage 1 is only noticeable in the X-ray. We know that stage 2 is what we call mild osteoarthritis. Stage 3 is moderate, and stage 4 is severe osteoarthritis. So in stage 4, the X-ray will show that there is absolutely no more cartilage, and the narrow space between the 2 bones is very narrow, so it's almost bone on bone. This can happen in any joint that has osteoarthritis. So when there is no more cartilage of the joint, then doing these exercises may aggravate the pain. I think that this person really needs to see an orthopedic surgeon and have a consultation to see if this is not a case for a knee replacement or a hip replacement surgery where they will put a new knee or a new hip. In this case, doing these exercises may not improve the symptoms, but it's important, if the person doesn't put weight on the joint, that they continue doing the strengthening of the muscles around the joint, because the stronger the muscles, the better will be for them to walk, even after surgery. If they have to do surgery, after surgery, the rehabilitation will be much better if they do these exercises even before the surgery. So it's not a contraindication to do this exercise, but it's just that it can aggravate the pain, can aggravate the symptoms, and it may not be helping. What the person really needs is surgery. The next question is still about this video. Dr. Andrea, is it possible to do the exercises without the weights on the legs? Yes, I did the demonstration using the ankle weights, attaching those ankle weights around the ankles to increase the amount of force that the person would be doing. Yes, the important thing is the person needs to understand that by using the weights is not going to aggravate the osteoarthritis. In fact, we know that the more weight we put on the joint for those exercises is going to make the muscles stronger. And think about the muscles around a joint almost like a support. When we tell the person to use a cane or crutch or a walker, it's because that cane is going to support the weight of the joint. When we have strong muscles, the strong muscles are almost like your own cane, your own crutches, your own walker, because it's supporting, absorbing the weight instead of the weight all going through the joint. It's distributing. So having strong muscles is really important for people who have osteoarthritis, and doing exercises with weights will only increase the muscles faster. But of course, if you don't have those weights and you can't adapt and create them at home, you don't need to buy those ones. You can make something homemade and wrap around your ankle. But if you cannot do those, if you don't have those, then please do the exercises without the weights. It may take longer for your muscles to build up and for you to develop those muscles. So the next question is excellent exercises, but you have failed to mention anything about our fascia, the connective tissue. Yes, I didn't mention the fascia, I forgot, or I just thought it was not important in the video, but you are absolutely right. The fascia is very important because it's the connective tissue around the muscles. So if you remember, when you buy beef, you buy a big chunk of beef, red meat, you see the red meat is the red part inside, but that white capsule around the muscle, around the beef, is the fascia of the muscle, which keeps all the muscle together. And I talk a little bit about myofascial pain. Myo is muscle, facial is the fascia of the muscle. So in my video about myofascial pain, I mentioned the fascia. And there are many therapies, fascia release, fascia strengthening, that people do, and many therapists that are trained in doing these therapies. And it's really important to maintain the structure of the muscle, to maintain the muscle stretched, that also the fascia is worked. So thank you for that reminder. Another question about, still about this same video. We have lots of questions about this video. I am 59 years old. I am able to do all these exercises. While I'm doing this exercise, I'm getting slight neck pain. Well, I don't know exactly why you're having neck pain because I'm not examining you, but I can imagine that some of the exercises I tell people to lie down in bed, and then while they're doing the exercises for the hip and knee, they will be also moving their head, especially when they're lying down. And if this is your case, when you're doing those exercises lying down, please make sure that you relax your muscles, the neck, the head, so you're not putting a lot of force and holding your breath and doing this with your neck and your shoulders, because then you're going to have some tension of the muscles. So please remember to breathe and to relax the muscles when you're doing these exercises. Then another question, can I do all the shown exercises if I have PIVD? And I believe you are talking about prolapse of the intervertebral disc of the lumbar vertebra. Well, these exercises are mainly for hip and knee pain. If you are having an acute prolapse, if this is an acute prolapsed disc, then it's better if you don't do these exercises if they cause pain. But even for prolapsed disc, you can do any activity. There is absolutely no restriction of activity what you can do. Just try to avoid the movements that cause pain, especially when you are stretching the muscles. This one that I'm doing here in the picture, because it's going to stretch the nerve root that may be being compressed by the prolapsed disc. If this is the case, then just avoid those exercises. When you have a prolapsed disc, usually in 4 or 6 weeks, the disc heals and that problem is resolved, so you should be able to do these exercises after the acute phase of the prolapsed disc is resolved. Another question, since I have had a TKR, which I think you're talking about total knee replacement, Am I permitted to do the toe touching exercise? So the toe touching exercise is that exercise that I showed that is stretching the hamstrings, the muscles behind the thigh, behind the knee. Actually, people who have a total knee replacement, one of the concerns that we have, the muscles behind the knee are tight, the hamstrings, and so they always keep pulling the knee in a flexed position. And that's a problem because if the person after having a total knee replacement is not able to fully extend the knee, then it's a problem to walk. So stretching those muscles is really important during the rehabilitation phase after a total knee replacement. But if you are having pain, if it's too tight, then talk to your physiotherapist and do slowly these stretching exercises so then you're not aggravating more your pain. But it's essential that you be stretching those muscles. The next question is, please let me know where I can get the link to the written report you mentioned in your video. I could not find the link. So when I talk about this exercise in this video, I mentioned that I summarized all these 20 exercises, the LAWS exercise, LAWS, in a document, and I put the link in the description of the video. So if you go to that video, of the osteoarthritis, exercise for osteoarthritis of a hip and knee, below the video there is a description. Just open that description and there is a link there to a Google document, and if you click there you'll be able to open the document on your computer. I think you have to go on your computer. I don't think smartphone, I don't know if that works, and then you can print and have a summary of all the 20 exercises. And so then you don't need to be watching the video all the time. You can print the exercises. It has a little picture of myself doing these exercises and the name of the 20 exercises, so then you can remember. So the next question is there any exercise in the above video that I should avoid doing for a trapped nerve? Well, I don't know what you're talking about, a trapped nerve. I'm not sure what you mean by that. Is this a disc herniation? Is this a trapped nerve at the hip, at the knee? I'm not sure. So if the person who wrote this question has a trapped nerve, maybe it's better if you talk to your doctor or show these exercises to a physiotherapist. Physiotherapist is a person who is a specialist in exercises, and show to them and see what kind of trapped nerve you have and what kind of exercise you can or cannot do. Next question. Do you have any exercise for frozen shoulder? Well, frozen shoulder is not a very rare disease. I see a lot of people with frozen shoulder in my clinic, so I should be making one video for shoulder. That's a good suggestion. And frozen shoulder, I don't have right now, but I will prepare one in the future. Thank you for that suggestion. Next question. Your words are blocking what you are trying to demonstrate. I think you're talking about the closed captions, because I have made closed captions in many different languages. My mother too, she uses those closed captions because she reads in Portuguese, and she told me this. She said that when she turns on the closed captions, the letters and the words are just on the top of me doing the exercise, especially in the last part of this video. I think there is a way that you can adjust the size of the closed captions. You can make the letters tiny. I'm not sure if you, on your YouTube settings, you can move the closed caption to different parts of the video, but I'm sorry about that. I didn't think about this when I was making the video. I will try to avoid this for the future videos, so thank you for the heads up. Next question. What are the causes of osteoarthritis? Yeah, I didn't mention too much about the causes of osteoarthritis in this video. So osteoarthritis can affect any joint of the body that is a synovial joint, that has the synovial fluid. The most common joints affected are the hands, the shoulders, the hips, and the knees. Ankles can also be affected by osteoarthritis. So what causes this? There's a lot of genetic influence. If you have your mother, father, siblings with osteoarthritis, chances are that you also have higher chance of having osteoarthritis. Being women, female, we have higher chance of having osteoarthritis, and also with older age is also important. Any joint also that has a trauma, if you had a fracture or a problem with a joint in the past, and trauma to that joint, this joint will be more predisposed to having osteoarthritis. And anything that puts more mechanical stress in the joint, like overweight, being overweight, too much weight, obesity can put a lot of forces and force on the bones in that joint. Any malalignment, if the joints are not well aligned, also can predispose the joint to have osteoarthritis. And any type of work that involves a lot of repetition of movements. In the hands, for example, people that use their hands a lot or do this movement a lot, they may be predisposed to have osteoarthritis of these joints. So a lot of factors that may cause osteoarthritis, but actually we don't know exactly what is the initial cause, except these things that I mentioned to you. Another question about this video. Oh, that was the last question about the osteoarthritis. Now I have some questions about the dancing with arthritis, which is a video that I made to help people to do aerobic exercises, which is an excellent movement for arthritis, for keeping your bodies moving. It's an excellent aerobic exercise. So in the video Dance with Arthritis, there was a comment, I find dance useful, but a bit confusing. Can you make it easy or improvise the steps? Well, I have to tell you, in the beginning, when I saw this choreography on YouTube, I found it very difficult. And I said, I'm not going to do it. I will not be able to do this. But then I saw some videos of this same choreography being danced with a lot of very senior people, very old ladies and gentlemen dancing this same choreography. So that stimulated me to create this video. And after I practiced for a few days and repeated and practice, suddenly I was able to do it. So I think you can do too. If you practice and if you listen to the song and practice those steps, you'll be able to do it. Now, if you can't, if you don't have time to practice, then improvise, you know. The important thing is just to move, to have fun, to listen to the music, to relax and do the aerobic exercises. Another question about this video. My doctor advised me to do stretches without putting load on the knees. Can I do these exercises? Well, if your doctor told you not to put loads on your knees, doing this dance, you're going to put loads on your knees. So I think you should not be doing this because that goes against what your doctor told you to do. Or you can show this video to your doctor and ask if you can do this dance or not, what they think about this. But please follow the instructions of your doctor. Then another video, the video of exercise for low back pain. There was a question, can this exercise be done with a herniated L3 disc? So again, if this herniated disc is an acute lesion, acute I mean is within 4 to 6 weeks that this happened, doing these exercises may aggravate your pain a little bit. It's not going to damage your muscles, it's not going to damage your nerve, but if the herniated disc is compressing a nerve root and that nerve root is inflamed, every time that you try to pull that nerve root, it's just going to hurt more. So talk to a physiotherapist and ask about what kind of exercise, because you can do some movements. You should keep doing movements for your shoulders, for your knees, but maybe not doing some of those stretches just because it's going to aggravate the pain. And then another question on the plantar fasciitis video. Is the pain also because of age? So plantar fasciitis, as I explained in the video, is pain at the plant of the foot, at the bottom of the foot, in the plantar fascia, and I explained some exercises that you can do in the video. So what causes plantar fasciitis can be a couple of things. Age is an important factor. We know that people who develop plantar fasciitis, most commonly, it's between the ages of 40 and 60 years old, and that may be because that's the age that the muscles are getting weaker, so they're not maintaining the arch anymore, so the person is having a flat foot, or even a person that has a very high arch may have plantar fasciitis. I explained that in the video. It can be either high arch or flat foot. But it's gaining weight. Also between this age, 40 and 60, a lot of people gain weight because of the hormones, or also because of the activities, walking, they're always on their feet. There are some professions that people who walk too much at work, ballet dancers, they have a tendency to develop plantar fasciitis, and people who are overweight. So yes, plantar fasciitis can be affected by older age as we get older, but also other things affect why people get plantar fasciitis. And another question or comment on this plantar fasciitis video: any exercise for shoulder joint? Yes, I don't have any shoulder video yet, exercise for shoulder. I will prepare one in the future. I'm thinking about preparing one for frozen shoulder, another video for impingement of the shoulder, impingement syndrome. These are two different things, and cause a lot of pain in the shoulder, and there are some specific exercises that we need to do for people who have impingement syndrome of the shoulder. So I will prepare one in the future. Thank you for the suggestion. And one question in the magnesium video: my pain always seems to be worse when I don't get much sleep. This is the reason why I have bought the magnesium glycinate. Have you any information on why flare-ups seem to happen after a bad night of sleep? Yes, sleep is very important, especially for people who have chronic pain. We don't know if it's because chronic pain and pain affects sleep, or people who don't sleep well, they have pain. They come together, and it's hard for us to know which one is causing what. But we know that if we are able to help a person to sleep better, the pain will get better, because during the night is when our muscles relax. You have to remember that we have the REM sleep and the non-REM sleep. During the non-REM sleep, we have 4 phases, phase 1, 2, 3, 4. During the phases 3 and 4 is when our muscles relax. And if the person is not sleeping well, they are not having enough sleep phase 3 and 4, they're not relaxing the muscles. So then the next day when they wake up, the muscles are all tense and they need more time to relax, and then the cycle starts all over again. So there are a number of things that we can recommend for sleep, and maybe that's a suggestion for another video as well on tips on how to improve sleep quality in people who have pain, arthritis, positioning in the bed. That's a good suggestion. Thank you. And the last question for tonight is on the video about neuropathic pain. Is there more information on alcoholic neuropathy? I think I didn't mention too much alcoholic neuropathy in my video. I just mentioned that alcohol consumption can be a cause of neuropathy. I have seen many patients who have very bad peripheral neuropathy and pain because of use of alcohol. So this has to be alcohol that is used daily for many years. We don't know if it's just the alcohol, the ethanol in the alcohol that causes the damage, or is it because of the nutritional deficiency? Because people who have drink alcohol, they also have deficiency in vitamin B1, B12, folate. They don't absorb well and they don't eat well, and deficiency of those vitamins cause peripheral neuropathy as well. So what the treatment involves for alcoholic neuropathy, first thing is they have to stop drinking alcohol, and sometimes it's not easy. They need to go to a detox program because they are so physically dependent on the alcohol that if they try to stop, they can have seizures, and these can be very serious seizures. So they need to stop gradually. There are some treatments for people who want to quit drinking alcohol, and then so after they quit drinking, we also need to think about nutritional deficiencies, replacing all the vitamins, good nutrition, and there are some medications that can help in the symptoms. However, we cannot revert the damage that the alcohol has done over so many years. All that we can do is to stop the progression of the disease and help to manage the symptoms of the alcohol neuropathy. So those were the questions for tonight. I will try to do these Q&A videos more often if you keep sending me your very interesting questions. And if you like this kind of video, just like this video there, write your comments if you like or you didn't like, and I will try to make this more often so then we can have this conversation here, because I really think that education, providing this kind of education, providing knowledge to people who have the problem is essential. And I really like to teach. I really like to educate not only my patients, but people all over the world. So thank you very much for watching my videos. Stay tuned, I'll be posting more videos. And thank you for watching today. Don't forget that I also am on social media. I tweet, I am on Instagram and Facebook. But you can leave your comments here if you go below. And don't forget to like this video and to subscribe to this channel. That's all for today. Thank you very much. Bye.